One very particular thing that we are really working on right now is electrostatic sprayers. TIPS is currently in the committee phase of setting up recommended guidelines for electrostatic sprayers, where we're looking at the application, the environment, and the chemistry. And what's so important with that is that these marvelous technologies like an electrostatic sprayer, they're great. I mean, they're the perfect applicator for chemistry, but we have to use them responsibly. We cannot let the manufacturers go out there and just make claims that you can use any product in any environment.
Millions of patients undergo surgical procedures every single day. They place their lives in the hands of healthcare providers who are committed to delivering safe, functional and sterile instrumentation for every surgery. Working behind the scenes are the technicians who go largely unknown, even to the patients whose lives are so dramatically impacted by their work. This is Beyond Clean, the global voice of sterile processing. Join us as we explore this hidden world and introduce you to the unsung heroes who are driving the advancement of our profession. And now your hosts, Justin Poulin, Michael Matthews and Hank Balch.
This week on Beyond Clean, we speak with Michael Diamond, co-founder and executive director with the Infection Prevention Strategy and TIPS, a nonprofit organization that recently announced $1 million in scientific impact in its first 24 months of operation. Michael is devoted to advancing information and science to address the myriad issues relating to infection prevention and global health. Mr. Diamond is driven by the firm belief that we should not have to wait years for promising technology, ideas, and processes to be implemented and accepted, and he has created a model of information sharing that makes the process of vetting new technologies and implementing successful programs and inspiring innovation more efficient, more accessible, more global, and more collaborative. Michael's most notable achievement to date is the TIPS online journal, which we'll be discussing today, as well as www.ic.tips, a pan-access worldwide collective that extends globally and touches locally. Michael leads teams around the world to develop trials and pilot studies to aid in the discovery of successful research-to-market technological advancements. His global team includes engagers and implementers. Currently represented in more than 30 countries and well established as the world's largest engagement network for infection prevention, the TIPS motto is join, contribute, make a difference. Hank, this should be interesting today. Certainly, I know they'll be looking for our listeners to join and contribute and help make a difference in the world of infection prevention.
Tell you what, Justin, there's no quicker way to get yourself an interview on the Beyond Clean podcast than really capture social media in the name of battling infection across the globe. I've been tracking Michael Diamond now for almost 2 years and really watching what the organization has done. And so when we created the podcast, he was on that initial list to get on the show. It's taken us a while, but I'm excited today specifically to talk about how to bring those ideas and innovations from the mind to the market. I'm really looking forward to getting insight from a guy like him who does have that global perspective on what it takes to get over the challenges and barriers to bring those things into hospitals and actually make them work.
Beyond Clean. Joining us now is Michael Diamond, co-founder and executive director at the Infection Prevention Strategy, or TIPS. And we're going to talk about a strategic approach to infection prevention today. Small ideas to marketable innovations. Michael, welcome to the show. Thank you for joining us.
Right on. Thank you for having me.
So why don't we just have you tell everybody what TIPS is and how it came about? I mean, I realize the infection prevention strategy may be a little bit bigger than that, but I think that's where it all started.
TIPS started actually in 2015, but we had the full launch in 2016. And we started in 2015, we were realizing there was a bunch of us, we were focused on the fact that Dr. Margaret Chen from the World Health Organization mentioned at the G7 the urgency on antibiotic resistance. A group of us were already circling some ideas on how to advance innovations and ideas and processes. We're fundamentally bothered with how large marketing firms from big conglomerate companies out there were controlling the market. And for right and for wrong, their technologies are the ones that are always most prevalent. We were looking at the issues with the length of peer review and how long it takes for things to come to market. And it was that catalyst that we went with on 2015, where we launched the world's first pan-access journal. And that was infectioncontrol.tips, or www.ic.tips. And, our mission statement is very simple. And so what we firmly believe in is what drives us every day, that we're driven by the firm belief that we should not have to wait years for promising innovations, ideas, and processes to be implemented and accepted. Our organization seeks out vehicles and methods to advance in these innovations and processes and ideas. We look for opportunities to communicate and talk about them more rapidly. We don't want to wait for a major paper to come out 18 months later. And then, everything we do is based on evidence-based science. Some of the stuff that we work on, when I say that everything we do is based on evidence-based science, we have our TIPS Sudden Science program, which exists to provide opportunities for trials and pilots in our conference series. This year, we are hosting North America's largest conference on sustainability and infection prevention. We have Craig Kilberger, who's going to be our keynote speaker from the Me to We movement, and our own Dr. Green, our John LaRochelle, and our Jason Tetro, who are all our board members, will also be speaking at that conference.
So, Michael, along those lines, I know you mentioned a couple of those challenges when it comes to bringing, an idea from that basic starter point to actually implemented. What are some more of those traditional barriers that prevent innovations from making it all the way to implementation?
When we started, I remember one of the things that we kicked around a lot is it's the wild, wild west out there in healthcare. Everybody with an innovation or a process or anything was out there trying to just push it and get it adopted. And then, since we've been doing this for the last couple of years, we really are advocates for really getting across to all the groups that we talk to about the importance and the value of an ROI. Doesn't matter how great your innovation is or what the underlying NASA research behind it that makes it so spectacular. If you don't have a practical ROI, you're not going to get anywhere. But also, let's be clear, once again, everything has to have evidence-based science behind it. Otherwise, it's just a bag of tricks that you'll be selling. Our Dr. Green says it best. Innovations and processes have to be implementable, sustainable, and effective. We've come across before wipes, for example, that don't have enough liquid for the application ratio, or how about the UV systems? John LaRochelle, who's on our team, he often talks about these UV companies coming to market with their amazing devices, but they haven't put any thought to the practicality of the wheels. Do they lock? Do they get stuck in the elevator? Do they pivot properly? Are they are they usable and practical for deployment? My favorite is antimicrobial paint. Here's a technology that I have always had issues with. Antimicrobial paint, if you read the manufacturer's guidelines, the efficacy of it is fine as long as the integrity of the paint is not interrupted. But in a hospital, you constantly have isolation, terminal, and discharge cleaning. You have escalated cleaning events that will degrade the paint. If that wasn't enough to be an unpractical solution for a hospital environment, how about the fact every 2.5 years you have to repaint the entire room with unionized labor? The whole ROI for antimicrobial paint just goes out the window. Those are some examples. But at TIPS, we realize that innovators are brilliant people. They just need some help moving forward with that practicality and adoption. And if they spend a little time working with us through our Sudden Science program, they'll find out the cost of repeat and redesign is far significant than the free accessible services that we provide. And through the TIPS Sudden Science program, when I say free and accessible, we provide a roadmap. We we are their partner, their journey partner through this process to market. We provide pilot and trial opportunities, and we provide usability studies. We do a lot. We'll do focus series. We do whatever it takes to help move that innovation idea or process into market through that journey.
Well, Michael, one of the things that is obviously it impacts the success of Beyond Clean, and it's really at the heart of what we try to do in bringing so many voices onto the show, is really developing our network and making it diverse, getting a lot of different voices, getting a lot of different opinions on the show. And I'm just wondering if you can talk, especially with your expertise here, on, what is the power of that vibrant or diverse network and how it impacts the success or growth of startups? Because I've been involved in multiple startups, and it's so very conceptual at the early phases that you really need all those voices because there may be applications that you never even thought of. So I thought maybe you could talk about that in a little bit more detail from your experience.
TIPS is a collective of knowledge leaders, scientists, researchers, developers, business people around the world that are focused on advancing all those innovations, ideas, and processes. I don't know if I said it before, but I'll say it again. We are all volunteers. And the amazing thing about TIPS is that we pull this group together, and we have the leading scientists with us. We have leading business people with us. We have leading researchers and people in the field around the world. We're in 30 plus countries, 12 countries specifically. We have engagement coordinators active and operating. We've published over 300 papers, perspective pieces, and editorials, of which 10% of them, 30 of them, are right now in the process of being translated in French and Spanish. So the TIPS network is a vibrant network. And what we do in that network to help pull all these knowledge leaders and experts together with the people that we work with through our Sudden Science program is we work through the vehicles that we've established to help communicate these successes, ideas, and processes. And that includes just our social media reach, which is phenomenally large. We also do focus series, and we do our showcase events. Our showcase events are really amazing. Recently, we did one in Buffalo where we literally parachuted in, and we brought in a group of about 100 people. We don't charge for these events. And the Buffalo one, I think, was specifically about if you can't clean it, don't buy it. Simple concept, but really practical. I mean, if we're in a hospital environment, if you cannot clean and disinfect, that should not be implemented in the environment. So what we brought to Buffalo for that showcase event was a world leader on the subject. We brought a world scientist to the conversation, and we had a showcase event. We did the same in St. Louis, Miami, New York. We've done it everywhere. Other things, as I mentioned, our conference series and our journal and how we engage. But more specifically to your question, when groups and companies work with us, one of the most valuable things that we do is we'll get on a discovery call with a particular scientist in the field, and we would then allow that discovery call this to take a path of its own for discovery, to help get questions, that insight that was never provided at the beginning stages to these groups before. That really helps clear the path for the next steps. At the end of the day, that simple effort of a discovery call with some notable scientists and researchers really helps them navigate the future.
Yeah, that's great, Michael. I know one of the more popular books that's out there sort of in the business world is this book by Stephen Johnson called Where Great Ideas Come From. And that's a really big portion of what he's talking about there, is that rarely do great ideas come from a single person. You know, there has to be those other people there that help refine the idea. And that can be really scary sometimes for these innovators to let another group come in and kind of judge whether or not it's a good idea or where the holes are or where it can be modified a little bit to turn it from a good idea into a great idea. So to have that resource available is really quite amazing. You obviously have kind of your thumb on the pulse of what's out there. So I'm curious, what's some of the cutting edge research and technology that's out there that you guys are seeing that you're really excited about?
Yeah, so I mean, some of the technologies that we're looking at intensely lately has been air purification systems. For the last 2 years, we've been going pretty deep with air sterilization and purification, antimicrobial technologies such as copper. Our TIPS Sudden Science program right now, I believe we have 27 projects going on around the world. But some of the stuff specifically that we would call our success stories include the Wello Station. The Wello Station is a barrier technology that you would put in for a sensitive area in a hospital or somewhere that reads rapidly within a second or two your temperature. I mean, that's, as we've published and mentioned, it stops infection before it spreads. TIPS took that Wello Station device, and we did a full IRB-approved study at 2 hospitals, wrote up a paper, did everything for it, got it peer-reviewed and published. We did that. TIPS contribution to that was at no charge. Other stuff that we've been working on recently is Luminor Copper Touch, antimicrobial copper technology. And we recently gave an award for an advanced irrigating room protection system. But one thing we should point out, people may not know about this, about TIPS. We work with a lot of organizations, healthcare, and critical environments to help develop their RFP. We look at cleaning methodologies. We look at technologies. We independently provide review and response information for a lot of organizations across the world, not just in North America. for their consideration on adopting technology. So if there's companies out there listening, odds are we've probably talked about you. We normally review the evidence-based science behind the technology, our unbiased opinion towards it, and then sometimes we go and even visit to talk about the practicality of adopting certain technologies.
Michael, I don't want to necessarily get into the weeds too far on this, but you mentioned the copper technology, and I've seen a lot of information on that, and it makes a ton of sense. And hopefully you can kind of illuminate a little bit, but I'm not sure that everybody who's listening to the podcast understands like the application of copper in the medical environment and how that can be a deterrent to spreading infection just because of how it works at the microbiological level. I didn't know if maybe you could give everybody some insight into how that is so helpful.
Right. So that's a great question. First to note, I'm particularly myself, Michael Diamond, is not a scientist. However, on your question on antimicrobial, and within 2 weeks, we have a paper coming out on a particular antimicrobial copper that is highly effective right now in Africa dealing with the Ebola crisis. Antimicrobial copper, the one I mentioned, the Luminor, is one of the ones that has received the EPA credentials for the antimicrobial claim. So antimicrobial copper itself, it's not the end-all, be-all. And I mean, I'm going to be very clear about this antimicrobial stuff. I talked about the antimicrobial paint where I have an issue with it that it doesn't generally use of escalated disinfection in a hospital environment. I have seen through several companies that do have the antimicrobial claim on copper that these companies have withstood escalated cleaning in these environments. And it's a different type of thing. So to me, if an antimicrobial can withstand the practical application in an environment, to me, it's a viable technology. So antimicrobial copper has some claims that it would ward off those pathogens over time, but it doesn't replace the cleaning. It doesn't even replace the disinfectant. It's just an adjunct technology to be used to reduce the overall contamination of the environment. But you still have to do your two-step cleaning processes.
We've talked about many times on this show how the sterile processing area is ripe for innovation. And I personally am convinced that there's a lot of great ideas setting out there on the front lines that are never going past the front lines because those technicians don't have a clue what to do with their idea from that point on. So what would you suggest to somebody who is that frontline tech who thinks they've got a winning idea? Can they approach TIPS and say, hey, I think I've got something here. Can you help me?
Absolutely. I mean, that's what we deal with daily. People come up with us, say, we have this idea. Some of them are at different stages of the development cycle. Some are just at the idea stage. Some of them have already gone out and done a prototype. Some need help building the prototype. And TIPS works with everybody in the Sun and Science program. The first thing we do is develop that roadmap. So if they were to reach out to us, and we have a simple application online that is very few questions, but helps us figure out a little more of them. We do a review of their idea, technology, or process, and then we do that roadmap, and we sit down and figure out how we can best help them. I mean, I got to be clear too that we have to believe in it. We have to believe in their idea. I mean, not everything. We get a lot of phone calls. Some of them we don't believe in. And our criteria to believe in something is based on evidence-based science. So if we can establish that what is being told to us has merit in science and can be proven in science or is worthy of being investigated, then we'll put our resources out there to help that advance. And then it starts with the phone call. It starts with online application, which takes 2 seconds, and then we move to a review, a discovery call, and we go forward with those people in those organizations to see what we can do. And a lot of stuff we do is business related. A lot of it is science related, whether we do a trial pilot and a lot of it's introductions. And we just navigate the roadmap the best way that we can help those innovations that we feel that are promising to the world.
That's really incredible. I mean, you're a nonprofit facilitating organization. I really think that it's easy to get involved because of that, right? There's no special interest. It's very objective. And I think there's a lot of value there, Michael. Let me ask you, one of the things we always talk about on this show is that the sterile processing voice is not nearly as contributory as it should be for like the development of things like instructions for use for new medical devices. Do you have somebody who is an SPD expert that's participating in TIPS today?
No, we don't. And we would love to have someone on board. I mean, I remember one of the underlying conversations we had in 2015 when we were getting together developing the concept of TIPS. We had, there was a few things in the news, the Ebola crisis, where the head of the CDC was out there proclaiming to the world they knew they were talking about Ebola, but they showed the PPE up there, and the PPE on the news did not match a bloodborne pathogen. I remember there was a major manufacturer out there that had a disinfectant that had it pulled off the shelf in the United States for 6 months, but it wasn't pulled off the shelf in Canada. And we were questioning the fact, does this product work, because it was based on a laboratory real world issue. And then the other thing that was circulating, which is right to the point that you brought up, was the endoscope problem in California. I remember that in the spring, I think it was 2015. And that was one of the underlying conversations we had. Is like, if the conversation has to be out there, if Europe was already dealing with endoscopes and the proper method for disinfection and maintenance, why weren't we doing that in the United States? So that, what you just asked, we would love to have an expert or someone to join our team to, if they're out there, to take on that role. So when we get those phone calls and we get those applications in and it touches on the space of the technology or the process, that we'd have that resource to go to specifically.
That's incredible. And I think we're talking about maybe getting more people involved, and that's really something that, going back to the whole networking conversation, that we really want to be part of as Beyond Clean. And so having said that, you're telling us that there's this opportunity to really raise that level of awareness and get involved with TIPS, and they're looking for people maybe from our listening audience to get involved and provide that voice. So if our audience has an idea or wants to engage more within the TIPS network, where do they start? How do they get involved? Who do they contact? Maybe just give them some information, because that's really something that we're hoping will be a takeaway from this interview is that we can help you get that participation that you're looking for.
That would be contacting me or our organization through any of our websites, which is infectiontips.org is the not-for-profit site. Infection Tips is the website, the journal, which is infectioncontrol.tips or www.ic.tips. Those are the two main websites to go to. Or contact me directly. To the method of joining, so our advisory board spans 4 continents, as a mandate of gender parity. If you look at the advisory board, which is everybody's listed on the sites, these are really notable people, and we would love to have anyone else join that group. And the method of doing that is by first contacting my team or myself. You'd be submitting a CV. We would do a check. We'd have a few phone calls, and then if we're going to move forward, we would submit it to the board for overall approval. And then we also have the committee level. We have multiple committees right now working on various projects. One of them specifically, we don't have one in the field that you just mentioned, but we'd love to create one. But we found a need to create a committee for recommended guidelines for electrostatic sprayers. And that committee is going to create these guidelines. We're in the startup phase of that. That's a 5-country committee right now, and we're hoping to publish these guidelines to establish proper use for electrostatic sprayers. We're trying to make guidelines where we're going to be establishing these guidelines that talk about chemistry, application, and environment. I mean, you would never spray an electrostatic sprayer with a quat in a daycare, and we discover that that does happen, or electrostatic sprayers, which are designed so effectively to really be the perfect applicator of chemistry. Some groups are spraying it with high parts per million of caustic toxic chemistry. And we believe these guidelines will be really effective on helping the decision makers and stakeholders and those in EVS and infection prevention really know how to apply such a marvelous technology responsibly. So we hope that those guidelines will then be introduced to the market, and then maybe a standard writing body like ISO or NSF International would pick it up and consider creating a standard and going further than we do.
All right, Michael, that's great. I definitely want to encourage people to get involved, but also, are there any events coming up that you want to make sure that our listeners are aware of?
Yes, I mentioned earlier about the Canadian Sustainability Conference we're hosting in Toronto, but I haven't mentioned yet the conference that's near and dear to my heart is the HITS Consortium International Healthcare Conference that we're hosting in Buffalo, New York in August. Now, the HITS Consortium is co-founded by Dr. Christine Green, who's on my board, and Dr. Kelly Reynolds from the University of Arizona, who's on our advisory board. And I'm on the board of the HITS Consortium, and so is John LaRochelle and another partner of ours, Savannah Hatt, who's also on the TIPS advisory board, by the way. The HITS Consortium is a 501c3 charity. Our conference in Buffalo will be our third international conference on healthcare. It's a working conference that we've really pioneered from 100 attendees in Ann Arbor in 2017 to 200 in Nashville last September. And we're shooting for between 200 and 300 attendees in Buffalo. And at this conference, we work on developing working groups that take the mission out there to bridge between industry, academia, government, and healthcare, and bring them together in a working group to either move forward on developing science, trials, pilots, or really vetting those technologies into the market. The HITS Consortium, being the charity there, is established to fund some of these ideas through the working groups that happen all year long. And our conference in all we've come from the working group status and talking about the development of the new working groups. Our recent successes include a CDC grant. We have some focuses on water technologies. We have some focuses on doing full 360 reviews and investigations on cleaning and disinfection.
Michael, that's some really fantastic work you're doing with the infection prevention strategy and tips. And I really want to just thank you before we wrap here for coming on the show, sharing that. And hopefully we've been able to reach out to our network and bring on additional partners that will only increase the effectiveness of the job that you're doing today and how you're serving the infection prevention community.
Great. Thank you. I really appreciate being on the show.
That was Michael Diamond, co-founder and executive director with the Infection Prevention Strategy and Tips. Mike, I know that Dr. Christine Green talked to us about this organization when she was on. So if any of our listeners out there are interested in getting involved, I think there's a lot of benefits to that. But certainly enjoyed the interview with Michael today.
Yeah, it was great to learn about the ways that collaboration can bring about some really incredible changes. And like you said, there's opportunity out there for sterile processing people to get involved. So, I mean, when you're a sterile processing technician, it can feel very isolated, but there are opportunities out there to take ideas and innovations and really interact with a larger community and potentially change the industry.
Absolutely. That was episode 7 of season 3. So we've got one more coming to you next week. Great job, Michael Diamond. But that's going to do it for this week's show. As a reminder, you can help support us by subscribing to Beyond Clean on iTunes or Stitcher, and now also on Google Play and Spotify. Simply search for Beyond Clean Podcast. We'd certainly appreciate a rating and a review as well, because your feedback is important to the show. And if you have any topics that you'd like us to cover, or if you'd like to share a picture anonymously on our Instagram page, just send an email to info@beyondclean.net. On behalf of Hank, Mike, and myself, thank you for listening to another edition of Beyond Clean.